What were some of the root causes of poverty in China? And are they pretty much the same in other places? Take India, for example. Would we find the same reasons for poverty there as well?
Well, not necessarily. I think each country probably has its specific conditions and the situation. You know, like I know in China, in the past, there's quite a lot of remote counties, villages, and far from urban centers, no transportation, no electricity, no internet, and then you know very harsh conditions, natural weather and things like that. So it's really I think there's a lot of difficulties China has. China has a vast territory, and you have a lot of mountains, you have remote areas, and then there's no education. I think one of the things that does really working is the education. China has implemented a compulsory education for them 1 to 9 across the country now. So all the kids now goes to school. That's remarkable. And also, as I said, they achieved you know, basic Medicare for 1 billion people, and then Social Security for 1.3 billion people. So it's really remarkable. Over 1 billion people actually enjoying some kind of Medicare and also Social Security.
William Hazeltine, your foundation is devoted to improving access to quality health care. The poorest are the most vulnerable. What do you see as some of the root causes of poverty?
Well, I think that we've touched on many of them. But I think what we have to look at as we look forward is a realization that major shocks like COVID are going to happen. There will be health shocks, so you have to have a health system which is prepared. And surprisingly, people who thought that the social welfare systems of Europe would buffer the shock of COVID has not done it. They have suffered horribly, and especially in the second wave. United States has certainly suffered from inadequacies of a centralized healthcare program without central authority. We've had terrible problems. But I think there's other shocks that we have to be prepared for. We've mentioned climate change, but climate change is probably going to be a bigger stress on bringing the world's population from poverty into the economies, into middle class, than even these healthcare shocks. These healthcare shocks we will get over. But climate change, the way it's heading now, we're not going to get over. We're going to be changing the macro environments that lead to mass starvation. We're going to be flooding our coastal areas. We're going to be changing the disease profiles in many countries where tropical disease are moving into temperate climates. And I don't see the world. This is something that where you really do have to cooperate on a world basis, both for health and for climate. And I think those are the biggest threats. Climate change is going to affect everybody, China included. And we need to make really good progress on that as well. And I think that is the area, both international health and climate change, where we need global cooperation to help buffer the world from these tragic consequences that are major setbacks for hundreds of millions of people.